Going to talk about a disorder that is called trichotillomania. So trichotillomania, or TTM for short, is a hair pulling disorder characterized by the repetitive pulling of one's hair. The scalp is probably the most prominent area that people pull their hair out. They will also pull out their eyebrows and eyelashes as well. TTM was first identified as a medical syndrome in 1889 by Francis Henry Halipo, but it was actually talked about in Shakespeare's literature centuries ago, even before him. So it affects 2% of the population, but 1 to 2 or 50 people experience TTM, which equals 2.5 million Americans may be affected by TTM sometime in their lifetime. The most prominent age is between 9 and 13 years old. So body-focused repetitive behaviors, or BFRBs, refers to any repetitive self-grooming behaviors such as hair pulling, skin picking, nail biting, scraping of the hair, skin, or nails. So you might hear TTM be referred to as a BFRB. The signs and symptoms, you will notice sometimes bald spots, and like they're just patches, or repetitive pulling, noticeable hair loss, like I said, missing eyebrows, eyelashes, biting, chewing, or eating their pulled out hair. So some patients actually end up with gastrointestinal problems, and they basically have a hairball inside them that has to be surgically removed. Some patients play with their pulled out hair. They'll just put it between their fingers. They will play with it on like their face. But the difference between normal self-grooming behaviors and TTM is that there's significant distress in these patients' life. This is affecting their daily activities. The causes, unfortunately, are unknown. Some researchers think that there's possible genetic or environmental factors. It is actually currently classified under obsessive compulsive and related disorders in the Diagnostic and Statistical Manual of Mental Health Disorders, fifth edition. So some researchers think that TTM might be related to OCD or anxiety. So here is the criteria for the DSM-5, and you can see that there's mild to moderate and criteria for severe to profound. So the OCD versus TTM, so there is controversy over it being classified as an OCD-related disorder. So with OCD, you have the obsessive compulsive and repetitive behaviors, but they're more rituals. These patients are going to check the lock 6 times at the same time every day, and do that every day. Like, they have to do that. With TTM, you have the repetitive behaviors, but it's not a ritual. You don't do it at the same time or anything like that. There's no tension prior to pulling, or there's no gratification after pulling. Like with OCD, you have gratification afterwards, after you do your tasks so many times. There's high comorbidities in OCD, but there's low comorbidities in TTM. Also, there's a higher treatment benefit from first-line OCD agents for patients just with OCD. And for TTM, the medications out there are pretty much just for OCD, and there's not a really high treatment benefit. So the best treatment benefit there is for TTM is habit reversal training. So diagnosis, suspected or obvious hair loss, eliminating any other causes of hair loss. So doctors will run some blood tests, check to make sure, there's not a deficiency somewhere or some other medical disorder. But they're also going to obtain a detailed history. Do they have any physical or mental health problems like OCD? or anxiety. Parents and caregivers. Parents also struggle when their child has TTM. Parents feel powerless, uncertainty, and grief. They feel powerless because they can't protect them from going out and, being made fun of by other children that don't understand what's going on. They also have uncertainty, like, how did this happen? And what did I do wrong? And that kind of goes with grief too. They blame themselves. Did I do something parenting-wise that made my child do this? So Parents Coping with Adolescent Trichotillomania is a great article. It educates parents about TTM. It gives them future guidance for their child and how to go about getting treatment and preparing for the future and dealing with this for a long term. There's also emotion-focused strategies, which are crying, getting emotional support, and being hypervigilant. So parents are going to cry. And one mother even stated, I cried in private and then I moved on and I did what I needed to do to make my daughter better. Gaining emotional support, whether that's from your spouse, your other family members, or going to an emotional support group with someone that understands like what you're truly what's going on. And being hyper vigilant, just really staying on top of everything and getting on top of treatment options for your kid. So there's also meaning-focused coping strategies, and that's acceptance, goal revision, and guiding rather than protecting. So accepting, they really just, you move away from really saying, oh, my child is going to completely stop pulling out their hair. Well, they're probably not, and moving towards, okay, what can I do to make my child better? And that also moves in with goal revision. What can I do since I've hit acceptance and I know this isn't going to go away, so what can I do to do things differently? Guiding rather than protecting, as one of the parents stated, they guide from a distance, which means they give them the necessary resources and skills to, protect themselves, because people are mean and there are hurtful children out. So giving them the necessary skills to protect themselves. So treatment for TTM includes psychotherapy, habit reversal training, and medication management. So psychotherapy, a big thing, cognitive behavioral therapy, or CBT, it attempts to identify and alter the thoughts and emotions that lead to certain behaviors according to the National Organization of Rare Disorders. This is the treatment of choice too for TTM, but there's also acceptance and commitment therapy and habit reversal training, which are also amazing treatment options. So habit reversal training was developed in 1970 by Nathan Azarin and Gregory Nunn. It has 3 components: critical awareness training and response training, social support. So some pharmacological treatments. So you have clomiprin, which it has an antidepressant and anti-obsessive properties. So it has been shown to be effective. You have your SSRIs, which have antidepressant, and they are FDA approved for OCD treatment. You have naltrexone, which is always surprising to see, because if you know what this drug is an opiate antagonist, but it has actually shown to help reduce urges in people with TTM or hair pulling. Neuroleptics, now they use this for TTM because they relate this to tic disorders and repetitive behaviors. Lithium, even though it is normally used for bipolar disorder, it has been shown to be proven helpful in TTM too. So what I did not tell you about this whole thing is that I suffer from TTM. And I have attached my personal story to this post. I am 25 years old. And I started pulling my hair out about 3 years ago. It arised from skin picking, and once my skin got clear, I started picking my face. And unfortunately, it was really scary, but I started having bald spots, and my fiance was the one that noticed it when I was in nursing school, where you have to wear your hair up. So I tried every medication, and I was like, nothing's working. And I didn't want to take naltrexone. I knew the side effects, and I was like, I'm over 21, and I want to have a drink once in a while, and I don't want to be sick, which it possibly can cause that. So I was like, there has to be something else out there. And I came across Keen, their habit aware bracelets, and I still wear it every single day. And as you can see from picture 1 is when my hair started growing back. Under that, in picture 1 was completely shaved because I had bald spots, and it was embarrassing, and I was ashamed. It took me a long time not to be ashamed of what I was going through, and as you can see in picture 3, I'm wearing it in nursing school, and my hair started growing back, and I started wearing it a normal length. And then in the middle picture is actually from probably about a year ago. So yeah, I'm very proud. And I actually have included a video in the next slide. And I'm going to go through it kind of quick because there are some important factors to it.
This is Keen, a smart bracelet to help you stop undesirable subconscious behaviors.
Hi, my name is Anila, and I pull out my hair. It's something I've been doing since 10 or 11 years old. I would just have these urges and feel these little tingles and would just want to pull. It was something that made me feel very, very alone, so much so that I hid it from everyone I love until one day I was caught. And I shared with my husband, Samir, which was really hard to do, but the best thing I could have ever done.
We set about learning more about the problem, and together decided to create a solution for her.
As a mobile app designer and someone who loves technology, I thought it'd be real.
Psychologists tell us that awareness is the most critical and difficult step in changing these types of behaviors.
So we started brainstorming how we could build this, and we found 2 awesome, super smart engineers that were just as passionate as we are, and we built our first prototypes. Within the first few days, I could feel heightened awareness. In a few months, I was able to retrain my brain away from the pulling behavior to more positive activities, like going for a walk, taking a drink of water, and deep breathing exercises.
We all deal with stress in different ways, but for some of us, this means biting our nails, pulling at our hair, picking our skin, or even sucking our thumbs, especially in older children. The problem is that these behaviors can be unhealthy, especially if performed subconsciously and repeatedly, as they often are.
We know there's a huge need for this product simply because people are telling us so.
It's a real great tool because it's hard to get at the automatic pulling because you're so unaware of what you're doing.
I think it's fantastic. I wish it was around when I was a kid.
Instead of getting yelled at from across the room, it'll vibrate, and that's a lot gentler of a reminder.
I think it's fantastic. I like that it's a very discreet shape. Every time you put it on.
Process. You do the motion you want to stop, and the bracelet records the position and silently monitors your hands. We are designing Keen with kids in mind. Keen is discreet and smart, and after calibration doesn't require a connection to the phone. You only notice Keen when you are doing something you don't want to be doing, and Keen gently reminds you. We are using sophisticated motion analysis to capture your specific gesture so you won't get a bunch of unnecessary reminders. In addition to the real-time alert, Keen's app gives you a beautiful visualization of your behavior, helping you track your progress and identify your triggers. Keen will even suggest replacement strategies to help you change your behavior in a positive way.
Now I have full eyebrows and eyelashes, but that's not the most important part. The most important change has been how I feel inside.